Thanks. This meeting's being recorded by the City of Greenfield. If any other persons present are doing so at this time, you must notify the chairperson. The chairperson reserves the right to remove or have removed any person or persons for profanity, threats, or continued disruption during this meeting. We're going to, I'll make a motion to table the review of that previous month's minutes.
Second.
All in favor? And I guess we can, do you think we need to do a quick roll call? We could do a quick roll call. Alyssa Valbona, chair.
Sam McIver, member.
Jen Hoffman, health director.
Nicole
Megan,
Hoffman,
Megan Tudrin, public health nurse.
Great. Thanks, everyone. Megan, we'll start with you. COVID and communicable disease updates.
Yeah. So in the past, say 40 days, we had 2 Legionnaires cases. They don't appear to be related. One of the cases did expire. And the other one, I believe, is still getting treatment. As far as COVID goes, we have lots of active clusters. All of the long-term care facilities have clusters, as well as a group home. We have 119 cases so far this month. We have 109 flu this month, 139 flu total from October. We did have 1 death so far this month for COVID, and we have 3 right now that are critically ill that that may not make it. Other than that, I think that is probably it for COVID. One of the other things, we do have a cluster of 12 cases of a GI illness in a facility. The epidemiologists and the physicians have not ordered stool samples, and they are not planning on it at this time. So most of the residents seem to be getting better in 72 hours, but it's vomiting, diarrhea, GI bug, probably the norovirus, they're thinking. And I think that is all that we've had for communicable diseases this month.
Megan, do you want to make note for the board about that there's no more PCR testing in our area?
Yeah. So GCC or Curative has shut down all of the sites across Massachusetts. So there will be no more PCR testing free to the public. Some doctors' offices are still doing them. I know Valley Medical Group seems to be doing a lot, and then people are getting them done at the hospital, but as an emergency room patient, not as an outpatient. So our numbers are going to go down a lot, I think, because we're not going to have them reported. The percent positivity right now is 8.5% for this week. I think that we'll probably be going into the red this week just because we have so many clusters, and our percent positivity and our hospitalizations are way up. We were seeing maybe 2 to 3 cases a day. I think the last list has been, what, Jen, 7 to 9 patients or so?
I think that this morning we had 9, and on a Monday we had more than that, and yesterday was 7 or something.
Yeah.
It was really bad on Monday.
Yeah. Any other questions? Yeah.
John?
Wastewater, anything to mention about that?
Yeah, our wastewater, we had a large spike earlier this month, like the highest that we've ever seen. It was like 3 million copies. And now we're back down to 1 million copies, which is kind of what we had been seeing through June, July, which seems really odd because our numbers are in our hospitalizations, our clusters are way, way up. So I don't know how this is happening, but it definitely seems like it was higher in October when we got that huge spike on our wastewater testing. I know not everyone is on the town sewer. We do have some septic systems, but it should be, we should be able to see the trend over time. And to have a lower trend right now just doesn't seem right.
Possible testing error, especially with the rains and stuff.
Any
And
other
it's-
questions? Oh, sorry, Megan.
Oh, no, it's also hard because our community partners haven't gotten their wastewater results either. Usually we compare ours to theirs, like especially Montague, because they're pretty similar in size. But they haven't gotten any results back. So we really have nothing to compare it to see what we really are at in Franklin County.
Any other questions for Megan? Great. Lent update.
So this past week, last week, we had a meeting with the DEP and the city and the partners involved about what's going to be coming up and follow up from what the PIP process showed. And it looks like everything's on track. We have to do air testing in some homes. They mentioned 2 people, the DEP mentioned 2 people that refused testing. And they're going to, for us, not us, but the LSP to follow up. I think I'm getting that correct. To say it's important that they are also getting tested. And basically it went over the same thing about, additional water testing and air testing that mentioned last time. I think I covered everything, right? I'm not sure, Alyssa, am I leaving anything out?
Yeah, I think so what they do is they notify the homes that need testing, and then there's like a card or like a form in the notification that the homeowners can send back. And so I believe one household just refused, and then I think 2 households haven't responded, but everyone else has gotten back to them. So they'll the LSP will follow up with the homes that haven't responded, and the DEP may reach out to the household that refused. But everything, there was an extension on the deadline, and I think everything else is on track. Moving on to food or restaurant updates, Nicole.
So we have the falafel inspection that I did over at the gas station across from Applebee's. They are not open yet. He still hasn't given me a date that he is opening. And I just wanted to add Mesa de Verde. I finally went there and did an inspection, and that was really great. They did a lot of improving, and they were actually really grateful that we reached out and are kind of staying on top of them, because they said they need that. They got in such a slump from COVID, not being used to having people in the back kitchen, and they had like a storage area out front, so they got rid of all that, and it's pretty much back to normal, and that was really great.
That's great. Any questions on restaurants? Housing updates?
Hey, Nicole, will the divide and conquer, because I did a bunch. So 59 East Cleveland Street is a case that we've had for a bit. Over the summer, we had multiple complaints about them not maintaining their lawn. It's an older gentleman who lives there and has somebody living there, not paying rent, but living there. We finally got access with the help of the fire department and the police department, because the gentleman refused access the first time. And we went in, and there are significant hoarding issues. There was very little heat because the person that lives with this older man was telling him that his thermostat was broken and it was not. So there's a lot of concerns. We filed some reports that need be, but we're following this gentleman very closely. And the fire department and the police department and myself, the health department, definitely have our eyes on this address. And we're following it very, very closely at this point. 5 Birch Street. I condemn this property. I was at a receivership meeting and the Department of Economic Development brought it up as something to look at. The home is unsafe to enter. It's the porch, both front and back, the back is worse, was not safe to walk in. When I went there the first time last week, the doors were unlocked. I locked the door. When I went back the next day to placard the home, the door was locked, except the back where I couldn't get was still unlocked. The woman who was on the paperwork that owns the home went there over the weekend and said it was unlocked again. So clearly there's squatters in the residence. And the main issue is it is not safe. The ceiling is falling down, the porch is falling down. There's wires all over the place. It's not a safe structure. So much so that the fire department called dispatch, letting them know it's not safe. Buildings is involved in this case as well. And I spoke to the previous owner. She surrendered the property to Bank of America on December 6th. I spoke to Bank of America today, as well as the agency to board and secure, and they're going to be doing that to make sure that the property is, because it's very dangerous. At the same time, I was informed about, at that same receivership meeting, 46 Turners Falls Road. Went there again. The home has been vacant for quite a long time. It's already boarded and secured. The woman who owns the home is very ill and is in a nursing home. She wanted to come back to the home, but again, it's not safe, and that is going to be moving on to receivership. You now, Nicole. I think the rest are yours.
So I'll start with 26 Congress Street. This is a 2-apartment building. The landlord actually lives on the first floor. The tenants called and complained, saying that the heat was broken. I went out with the fire department to make sure that the heat vents were unplugged, because there was a call from Sandry that they had blocked their vents. Let me back up. They didn't want to let Sandry in at first to fix the system, and we explained to them how important it was for them to follow through with things like that. Otherwise, it looks bad for them if there's a situation where they need to go to court or something. We spoke with both landlords and tenants, just explaining to them how their heating system works. It's a really small house, so it seemed as though the tenants on the first floor weren't using any heat, because the heat from the furnace was blowing up and warming that apartment, and then they were saying that they were turning it down so they weren't warm enough upstairs. It ended up being like a civil-ish matter. We haven't heard from them since, so that's a good thing. 173, 175 Conway Street. The fire department went out there on 12/17 for a reported water problem. This is a almost city-owned or bank-owned property. The DPW had to go out and shut the water off. Berkshire Gas had to shut the gas service off, and Eversource disconnected the power. When I had gone out there on 12/19 to condemn the property, it did also look like some squatters had been living there. The owner is deceased, which is why it's been going into ownership of the city. and the relative that had been living there, I believe, is incarcerated. So that property is now condemned. And I took photographs one day and asked the fire department if there was changes. And in fact, people had been going in and out again after the services had been shut off. 259 Chapman Street. This has been a property that I think we've been dealing with for 3 years now. We thought after the landlord got the last tenants out that it would solve all the problems, but in fact, that's not the case. Instead of asking the landlord to try and ask these tenants to clean up the yard, we went a different direction with a civil violation of $200. There's large amounts of trash on the porch, strong odor, food, mattresses, what looks like their Thanksgiving dinner was still there. But so that we're trying to help this landlord now try to figure out what he's going to do with these tenants because of their non-compliance and not taking care of the property that they're living in. Did I get them all? Yeah. Okay.
Thanks, Nicole. Thanks, Jennifer. Any housing questions? Great, then we can move on to grants and academics.
Okay, so we have two. I had to add one in with the intermunicipal grant where we have the 6 towns. We did phase 3, which was a real big part of that grant. All the towns have completed that phase. So now the state is looking at everybody's needs and how they do different types of inspections. And they're going to go over with us how we have room for improvement and standardization that we need to follow. So I also had to create job descriptions. I did one for an inspector, one for a full-time nurse who would also be helping Athena Bradley, the grant manager, with the grant management, as well as a part-time nurse. Both of those, all those positions are going to be shared among the 6 towns. They're not just for Greenfield. However, last week I was informed of a grant, a CDBG grant, that because I have so many problems with elders who own their homes, who are incredibly poor, I applied for the maximum of a $25,000 grant. I had 2 days to do it. So I rushed it together and we'll see where it goes. But the goal of that grant is for extreme elders at risk, who are pretty much hoarders, who have no family support, no social network. Social service agencies that we deal with, we've had a lot of challenges with. And I think that this would help the health department help these people when the social service agencies are like, oh, they don't need help. And we're like, how do we help them? So I should know by the middle of January or so if I get the grant.
That's great. You said that was community development?
Yep.
Cool.
CDBG, yep.
Yeah, that's awesome.
Thank you.
And then the MPH, that's an MPH student, right? The capstone.
This one I'm really excited about. Her name is Jennifer Siegel. She's a graduate student. I'm working with her for her capstone. And it's a nice spin on the day-to-day, because it really makes me think and mentor somebody. So I'm really happy. And she's really looking at COVID in a different way, because everyone thinks of racism and certain things like socioeconomic factors. And we were talking about in Greenfield how 12 to 15-year-olds were the least vaccinated. And we started talking about, well, what are these factors? And we looked at ageism. And that's what her capstone is going to be on. Ageism, people think of older people, not necessarily younger people, but it's still a factor, and how they don't have a say, even if they wanted to get vaccinated. If the parents say no, they can't do it. So looking into that dynamic and why that's the case and how we can help support that. So I'm very excited about her capstone.
Awesome, thanks. Does anyone have any questions about those grants or that project? Great. Jen, I think you had one thing you wanted to add to the end of the agenda, and then
Yeah, so
Okay.
two things. One was, I spoke to you about if you wanted the orders to correct prior to
Oh,
the
that's
meeting.
right. Yes, that's right. So this was something that Jennifer brought up. Sam, this is really for you and I to decide.
I don't
in-
think that John's here, the other board member.
Yeah, I don't see John here.
And TJ's here, Dr. Lepre, but
Yeah. But in Montague, as part of the board packet, Jennifer's been providing the orders to correct for the different properties. Is it properties or properties and restaurants?
properties and restaurants. Well, if there's problems with the restaurants.
Right. In advance, just as part of the board packet, so we have a little bit more context to those things that come up. And so I said we'd throw it out at the meeting and see if that's something we all found helpful. It's just two of us tonight, but and if so, we can start that in January's meeting. So I don't know if you have any thoughts on that, Sam.
I think it's a great idea. It will help kind of pull in all the pieces to each story.
And I was just thinking that in case someone is coming to the board with, appealing the order, you would see the code and be very clearly, because it's written there on why we have cited that code, because we write down the reason under it. So I think it would be helpful, instead of us just telling you the summary, just seeing what we actually did.
Great. So it sounds like we all agree that would be helpful. Thank you so much for adding that to our board packet.
The other thing that I think we should discuss is homelessness. As you know, that the health department engages with the homeless population in Greenfield on many different levels. This weekend for Christmas, I was contacted by Mr. Whitney about the flooding. So I was working with Chief Strand from the fire department and the Salvation Army and Mr. Whitney and Ms. Duclos, and literally trying to get people shelter because everything was washed away. And the analogy I give is, when there's a hurricane and a rich person's mansion, they lose their home, right? And that's all their belongings. This is their mansion, right? This is their home, and all their belongings went away. So after Friday, Saturday comes and it's the aftermath, and people are in shelters, and some people were coming out of wherever they were, and it's getting additional shelters for them. Miss Duclos and Mr. Whitney were getting food from Stone Soup. The Red Cross gave money. Larry, I forgot the social service agency he's working for, but he gave $50 gift certificates for them, and they were taken shopping to get tents and other stuff they needed. And again, working with the Salvation Army to help them get housed, temporary heat in a hotel. So I wanted that out there, that the social service agencies, The only one I worked with was the Wells Street Shelter. I spoke to the supervisor. There were 4 beds available. If I needed it, they put it off to the side. There was also another individual who we couldn't locate. And she kind of was doing and digging and found out where this person was. But there was a really big concern at one point if they were still down by the bike path. So I do, give credit to the Wells Street Shelter because they were on board, but there was no one else to be seen. So it was fire. These great individuals who were out there in the snow and cold looking for everyone and trying to get them help. The health department and police trying to all try to come together, and it shouldn't have been that way. But on that note, I also wanted to discuss, a while ago, we had a problem with the homeless behind Stop and Shop. And yesterday I was in my office and a constituent came to the office and was very upset, saying that we made fun of Stop and Shop and that there's trash and they're going to be reporting it to all different agencies. And the issue, we looked back, Nicole has the record with her, but we looked back on the file and there was no making fun of Stop and Shop. I want to make that clear. I think you guys would remember this. The issue was that the homeless encampment is on Stop and Shop's property. When I approached the DPW to help remove the trash, we cannot remove trash from someone else's property. There's a map she's showing. And it was Stop and Shop's responsibility to do so. We have informed Stop and Shop. They're aware of it. If they don't remove the homeless or get the police to help them remove the homeless, if they don't ask the homeless to clean up, if they don't clean up, there's nothing we can do. It's like us, forcing other people to do it. If they're refusing, it's Stop and Shop has to do it. The health department is in support of helping the homeless and trying to support the homeless in how they can. We are in support of not having trash. We have been at multiple meetings where we talk about sharps containment and maintaining trash. As a matter of fact, the same 2 people that were searching for homeless people down by the bike path informed us of trash. I informed the DPW, and they are going to be picking up the trash that is collected because it's on city property. So I just wanted the board to be aware that there might be some discussion of this. I think the board may remember the Stop and Shop discussion. I think you both were on it. And I just wanted to know if you had any comments before any public comment about that. Thank you for letting me speak.
Thanks, Jennifer. And yeah, thanks for everyone's efforts in helping folks out over the weekend. Pretty tough weather time. This time of year is always tough for our unhoused neighbors. So I'm glad that they were able to get some help. Sam, do you have any questions, comments? No. Great. So with that, we can do public comment. We can do 3 minutes per person if there is any public comment. I don't know if there is today. And if you would like to comment, just throw your name in the chat and I'll run down the list.
Hi, my name is Ryan Whitney.
Are you
I was-
offering public comment, Ryan?
Yes, please.
Okay, I'm asking folks to put their name in the chat and then I'll.
I just can't find that. Hold on.
Oh, okay. I don't see anyone else, so we might just be able to have your comment and then go from there. Does anyone else want to throw their name in the chat or raise a hand maybe if you're having trouble finding the chat function? Okay. It doesn't look like there's anyone else, so I'll just get my timer going and Ryan, you can take it away, okay?
Hi, my name's Ryan Whitney, Greenfield, Mass. I was the one that Jennifer was talking about, me and my partner. She's here with me. Um, we had like the Stop and Shop thing concerns me because then there's going to be even more homeless people. And I was talking to the homeless today earlier, texting back and forth to some of the people. They're in the hotel, the ones that got flooded out, and they want to move back up towards the fairgrounds. And I don't know if they got kicked out of there before. Like, so everybody keeps getting kicked out and moved around and all this stuff. And I already talked to Jennifer Hoffman about it a little bit, like of finding a permanent solution for some of this stuff, like a designated area or something like that. But it, and we had talked about a warming shelter. I hope there's going to be some pressure on the mayor and CSO to open a warming shelter back up because everybody's stuff got like wet, and people are living in tents, and when they live in tents their stuff occasionally gets wet, and there used to be a warming shelter with a dryer and a place for to take a shower. Like some of my friends down there, and I call them friends because I do hang out with these people, I did find out like who they are and like know their stories and all that. They hadn't showered in like 2-3 weeks, and staying at the hotel at least gave them an opportunity to shower, but now they're going back out into the cold and they don't really know where to go and don't know if they're going to be kicked off of that property again or moved again. So I think there needs to be some discussion about where a designated spot for them, honestly. And I don't know much else. Jennifer has talked to me at length, so she knows where I stand. Just wanted to put a little bit in there. Thank you.
Thanks, Ryan. Stephanie, I see you'd like to make comment also. Go ahead, Stephanie.
Hi, Stephanie Duclos, Chapman Street. I find it very disheartening, and that's me putting it very mildly, that CSO had a warming shelter during this crisis and did not open it. It took citizens to scramble around to work with the different agencies like BOH, the DPW, the fire department, the police department, the Salvation Army, the Recovery Center, the Red Cross, to get some movement on this. And when there are big projects coming into Greenfield, and we're going to be funding portions of them, an agency that is essentially the homeless's resource for their mental health and other services they need, and they're failing them. They didn't open a house, and people were going to freeze if people didn't go out there and find them in the woods. And you see all over Facebook that, they're rescuing a cat out of a hole on Chapman Street, and everybody's concerned that the cat's going to freeze. Do you see that about the homeless? To me, there's not enough attention. There's not enough light on it. We have Greenfield residents that are out there. They're freezing. Some of them want to remain out there, but there's a couple out there with a baby that they want to get back, and they have nowhere to go. That's all I have to say. Thank you.
Thanks, Stephanie. I don't see anything else in the chat. Anyone else having trouble with chat or raising a hand? Otherwise, we'll close public comment. Okay. Yeah, and like I said, this is always, it's a tough time of year. Really appreciate everyone's efforts and helping out. The health department, will continue to do what is within the purview of the health department in this difficult situation. Our next meeting will be January 25th, 5 o'clock. Sam, any last?
I will be at that meeting, but I will not be at the February meeting. Unless we change it, I will be on vacation.
Okay, I will, at mine and Jennifer's next meeting, we'll take a look at the February date. I actually might be out of town also that, with when that falls, so we can, maybe talk about moving that meeting.
Okay.
Is that school break week? Yeah, so we'll, we'll probably have to rearrange that weekend, or I mean, that meeting. Okay. Anything else before I make Jennifer or Nicole or Sam, before I make a motion to adjourn? Okay. So I will make a motion to adjourn the meeting.
Second,
All in favor?
I would like to thank everybody that helped out. You guys were amazing. Thank you.
Thanks. Yeah, thank you. All right, have a good night, everyone, and have a happy new year.